Welcome back to GEMS Podcast. I am the founder and host, Miss Genesis Amaris Kemp, and with me today is Dr. Aimee Duffy. Here is a bit about Dr. Aimee. So, Dr. Aimee is the #1 best-selling author of Normal Doesn't Have Side Effects, award-winning speaker at Harvard Club of Boston, CNN Center, Nasdaq, New York City Bar Association, and the Philadelphia College of Physicians. Dr. Duffy has shared the stage with Martha Stewart, Suzanne Somers, and Dr. Oz, as well as a few others. She is a frequent podcast guest and expert guest on ABC, NBC, CBS, and Fox network TV shows. And today we're going to hear both sides of what it's like for her to be a physician, but also the patient side, dealing with hormonal issues, gut imbalances, and stuff like that. That can definitely help you look out for those signs that you may be dealing with, and you may not feel like you are being seen and heard by your physician. So she's gonna give you some tips and tricks regarding that, as well as talk about some things that may help you bust those myths. So without further ado, please welcome Dr. Aimee Duffy to GEMS Podcast.
Good morning.
Good morning, Dr. Duffy. So before we dive in, we are going to have a bit of an icebreaker. So you have two options here. If you could say a crazy thing that you've done in your life that you've either learned from or that is just fun and crazy for you to do, or you could say a fun but interesting fact about yourself.
Well, how about we combine both of them together? One of my favorite stories is that I delivered my own baby. So I delivered thousands of babies over my career. I started deciding that I wanted to be a doctor when I was 17 years old. I was a babysitter for a family and they were having baby number 2 and invited me to actually be in the delivery room with them when I was in high school, basically. So I was 17 years old. And through that experience, I thought it was the best thing that ever happened in the world. And I was like, I want to do this. I want to be a doctor. I want to deliver babies. And I did. I went to college, I went to medical school, finished residency, and I delivered over 1,000 babies in my career. But I would say one of the most memorable is my baby number 4. So typically speaking, when you have multiple babies, they often get easier as time goes on. And so by the time baby number 4 came, I had the first 2 babies without any pain medication at all, or epidural or anything like that. By the 3rd one, I thought I was going to do it, but she came so fast that they didn't have time. So I had another one with no epidural. And then by the 4th one, I was like, give me the epidural quick. I was getting induced because my blood pressure had started to go up a little bit. So they just decided it was time. Let's go ahead and have this baby. So, I started the medications. I got my epidural really early and I was just kind of hanging in the bed, chilling, talking to my family, and not much going on. And the nurse came in and said, man, your baby is just moving all over the place. It's hard for us to keep her on the monitor. Is it okay if we put a scalp electrode on her head internally so we can keep an eye on her heart rate easier? And I had done these many, many times in my career with my patients. And so I was very comfortable with that. I said, sure, no problem. So she grabbed another nurse to help her out. And now I have this epidural and I can't feel a thing, basically from my belly button down. I can't move anything. This was a very, very strong epidural. Maybe a little bit more than I would have liked, but I can't be too picky about it. I wasn't feeling anything. So the nurse on my left-hand side kind of picked up my leg and moved it over to the left-hand side. And the nurse on the right picked up my right leg and moved it over. And then bam, the baby's on the bed. She just popped out. So there was no pushing. There was no, you're 10 centimeters dilated, time's happening. And I immediately went into doctor mode because that's what I do. I've delivered so many babies. I just reached down and grabbed her. I grabbed my white hospital gown. I started wiping all kind of the blood tinged goo off of her. And she wasn't getting that, good baby cry yet. And so I said, I need to suction her mouth out. She's got a bunch of fluid in her mouth. Let's suction her out. So we suctioned her out. And then she still, she was fine. She wasn't like turning blue or, anything going on, but she wasn't getting that good, deep cry that you want to hear right away. So I said, I need to cut the cord. So they handed me the clamp and the scissors, and I cut the cord, and I handed the baby over to the nurse, who took her over to the monitor, and she immediately started crying. Best sound in the world. But so that's my story. I delivered my own baby. Kind of crazy, kind of interesting, and fun fact.
Wow. I'm over here like, wow. Just a point where you said, oh yeah, she moved my left leg, she moved my right leg, and then bam, the baby just came out.
Just there.
Oh wow. That is crazy. So when you were going through all this, you just like jumped into it like it's game time.
Yeah, it was, I mean, again, because I had done it so many times in my life, I mean, there was no, what do I do? Or, anything. It was just, oh, here's this baby, as if I was on the other side of it delivering a baby. So I just went through the motions that I had done so many times. It was really, I don't know if you can look back and say out of body experience or anything, but I don't remember feeling any emotional sensation, like, oh my gosh, this is my baby. It was just kind of like, this is work, get this baby breathing and wiped off like we normally do when we're delivering a baby. So, once everything sort of settled down, I heard her cry, they wrapped her up, within minutes she was back, as a little baby burrito in my arms. And then I could go, okay, this is my baby, and, have that emotional connection. But it took a moment of just kind of getting in the zone of take care of this baby.
So after baby number 4, did you say, oh, I think I want another baby? Or were you like, no, I'm done?
No. In fact, I was processing the idea of being done at baby number 3. And before that, anything happened, I was pregnant again. So my 3rd and 4th babies are literally like 20 months apart. So I still had a baby when I got pregnant with baby number 4. So I hadn't quite made a full decision yet, but definitely after baby number 4, it was time to say our family was complete, and it's perfect.
Oh, nice. So thank you for sharing that fun, interesting, and crazy experience. So, Dr. Duffy, outside of, you getting a taste of, just being in the delivery room at 17, saying that, okay, I fell in love with medicine, I really want to be a doctor. Was there anything else that was drawing you into the physician world?
I think I grew up in, I call it the granola family. I mean, we were very sort of holistic and healthy, and did a lot of alternative stuff like acupuncture when I was younger, massage therapy, rolfing. My mom was really into a lot of those things. And so I experienced that as a young person. And especially loving babies, even as a child, I had Cabbage Patch Kids and, all the babies. And so, I think that I knew I either wanted to be like a pediatrician or deliver babies, or at one point I wanted to be a teacher, but I think I really realized also that I was good in school. So, it kind of was fed into me, oh, you should be a doctor because you're so smart, on top of this idea of wanting to be around babies and things like that. And ultimately now, I delivered babies for many years in my practice, and unfortunately, they don't come on your schedule at 2:00 on Tuesday afternoon. So with 4 babies at home, it was time to put that chapter to rest, and not be on call every 3 nights and be exhausted all the time. So I had to make, major decisions in life to move forward with that. And what I love about what I do now, which I think I could look back and say, this is really why I went into medicine, is that delivering babies was fun. It was good medicine. You're as a pregnant mom, you want to go to the doctor because you want to find out what's going on with my baby and good things are happening. And, there's like this countdown, right, to this exciting moment. It's not, I'm going to the doctor and hearing bad news about my health and my, I've got high blood pressure, or I'm sick or something like that. So it was always fun for me. And now my work now is what I call integrative or functional medicine. It's wellness, it's health. People love coming in because we're giving them tools and support and knowledge about what's going on with them and how they can actually do things to help improve their life and feel better, and not feel kind of weighted down like it's their fault that they don't feel good, or that they have some, diagnosis or disease and their only action is to take their pill every day. That's not really helping them get to optimal health, right?
Yeah, absolutely. And let's stay in this area for a little bit. So, integrative wellness and health. So, let's break it down by a dictionary definition. So, I want you to lay the foundation and let the listeners and viewers know what exactly do you mean by integrative health and wellness? Like, is
Okay.
it the naturopathic stuff paired with Western medicine, or what are your thoughts?
Exactly. Yeah. So there's two words that are used often. I don't want to call them interchangeably, but used together. So integrative medicine is the idea that exactly what you described, that I think that there's a spectrum. There is, the hardcore traditional medical world where here's a diagnosis and here's the pill, that you're going to take. And then there's the opposite side, which is something like acupuncture or, alternative type practices. And to have somebody who has the knowledge on both of those spectrums, and then when you come into me as a patient, we can come together with a plan that says, how can we incorporate some of these things together in order to get you to your optimal place? So we don't have to choose one side of the spectrum or the other, and we can really blend it in. And people on the more natural side of medicine and those alternative health fields, they can't order labs or write a prescription if needed. And on this side, traditional medicine very commonly doesn't either know about or doesn't really support the use of some of these alternative practices to blend together. So that's the term integrative, is to be able to come to a patient plan and interaction on how are we going to get your health better by using a modality of different varieties of treatments. And then the functional medicine part is really going deeper into, we use the term root cause. We're looking for why is your body doing what it's doing, excuse me, and not just band-aiding a symptom. So functional medicine's job is to get your body working back to its normal function, which is where my book title comes from. Normal doesn't have side effects. So we want to get your body and your health working, quote, normally, which is going to be optimal. Everything's working the way it's supposed to. If we start to understand why it's not working the way it's supposed to and correct that, then there's there's no pill that you have to take that has a side effect you have to worry about. You're doing what you're supposed to do, and your body is very smart and will adapt appropriately to the environment it's provided.
Absolutely. And thank you for sharing your meaning of the terminology behind integrative medicine. And so, whenever you look back when you were a physician before you started your practice now, do you feel like there were certain checks and balances that you needed to follow within the physician versus pairing it with some of the holistic and the naturopathic remedies? Because maybe you had certain things that the pharmaceutical companies were, promoting to you that you had to offload to patients. And then and it goes back to that Band-Aid thing. Okay, I'm giving you this prescription, but then this prescription ends up creating this side effect. Then I have to give you another medication. And then some people feel like, oh my gosh, like what's the point of taking all this medicine? I'm like a walking medicine cabinet.
Exactly. I mean, that is what my patients deal with all the time, especially when they have this long list or handful of pills, and then they can still fill out on my forms and say they have, chronic fatigue and they're frustrated with their weight and they hurt all the time and they don't sleep well and they're irritable and frustrated and their gut's a mess. They have IBS. They gotta know where every bathroom is everywhere they go because they never know when that's going to happen, that kind of thing. So really what started me down this path, and this is a great question for that segue, is, I was in the OBGYN field. And so I was delivering lots of babies, which was fun. But on the days that I wasn't delivering babies, I was kind of thrown into women's health. And that has a lot to do with hormones, right? So women come in and varying degrees of ages, but we're talking about women that are in maybe their 40s to 60s, dealing with some hormonal changes and going through menopause. And that was, 15 to 20 years ago. When I was in medical school and residency, the huge study on women's health came out from the Women's Health Initiative. And there was a lot of concern there with hormone replacement, particularly using something called Premarin and Prempro. Those were the drugs that were in the study. But the end of the study was actually cut short because they were seeing so many negative effects with these, and like something like 283% increased risk of breast cancers and strokes and heart attacks in women that were taking these medications. Why it's still on the market, I don't know. That's a whole nother conversation. But yet, you know, women were hearing this, and it was in the media and it was everywhere, and we're hearing it as physicians. And now we're stuck in this. What do we do? This is stuff we've used for years and years, you know, telling people it was safe, and it was either good to help with their symptoms or it was protecting their bones and things like that. And so now my conversations had to be about, you know, here's this pill, I could give it to you to help with these hot flashes and this irritability. And, you know, you want to rip your husband's head off because he smiled at you or whatever, you know, they're all crazy during this hormonal time, but I can't trust that it's actually good, right? So as a physician, you take the Hippocratic oath that says, I promise to do no harm. Well, here we are with this information that this medication could cause a lot of harm. And that just didn't sit right with me. You know, I'm trying to talk patients out of it, but yet we didn't really have any solution for dealing with those symptoms. There was the advice that we could just put them on antidepressant medications. It's kind of like, well, you know, you're going to have hot flashes, but you're just not going to care about it anymore. That's kind of what that was. And that really wasn't the cure, right? So I started doing more research in that area of hormones, and I happened upon the idea of bioidentical hormone therapy and natural hormone balancing. I started listening to, we didn't have podcasts back then, but it was like, you know, web recorded seminars and things like that. I could listen to that. And then I searched and found conferences on bioidentical hormones and natural hormone balancing. And I just dove in, and I was just so intrigued by this idea that we could find what the imbalance in the hormones were. Then we can replace natural hormones. Bioidentical hormones means that it's the chemical structure is exactly the same as the chemicals that are in your body. But also bioidentically, we need to use the right dosing. So we're not using these huge doses that your body never made, except maybe when you're pregnant, you know, you're swimming in progesterone. But outside of that one particular time frame, there's no time when you have these huge doses of estrogen or testosterone or things like that. So it makes it much more easy to help people be more comfortable in what they're choosing in terms of balancing their hormones, seeing a test, seeing what the needs are. And then the most important thing is to test, do the intervention, and then repeat the test to make sure that we're in the right place and things look normal or appropriate for where we're going to be. And then you don't have those risks that were there with all the studies from the Women's Health Initiative.
Beautiful. And I like that you took it upon yourself to say, I'm going to go research and find another way, an alternate way, because had you been the person that was going through this, you wouldn't want to, you know, be going through the same things that these women were going through. So there's always a root cause analysis. And there's always a way to overcome that whenever you understand what's going on and what are the underlying causes. And I feel like more people need to be open and susceptible to natural remedies and modalities, because if you think about what people did years ago, a lot of people weren't taking these pharmaceutical drugs or whatnot. They were using what was produced in the earth, and it was working well for them. And it's just like, okay, you talked about hormones. So there are a lot of women who have hormonal imbalances that, you know, it makes it harder for them to get pregnant. So do you see any of those women within your practice?
Absolutely. I don't necessarily advertise that I do infertility, because a lot of people, you know, look at that as, you know, the main, you know, in vitro fertilization and things like that. But, you know, for me, I definitely see that. I see it starts to become this balance, and we can go into the, you know, the finer physiology if we need to, but your hormones are very much affected by your neurotransmitters, what's going on in your brain, how your adrenal function is, so your stress hormones. And then those stress hormones also affect your hormone levels. And so often in younger women, when I'm seeing, you know, late 20s or 30s women who have had difficulty getting pregnant, it's very common for them to have pretty significant adrenal fatigue where their cortisol levels are low. and also have really low progesterone levels. And you know, certainly you can treat that by prescribing some natural progesterone support. And, you know, there's supplements out there for adrenals, but you really have to get to the source. What is stressing the body out? You know, where is this adrenal fatigue coming from? And for a lot of people, there is outside stressors, but there's internal stressors with gut inflammation. And if you don't address those things, I always tell patients, you know, this is like, you go back to the caveman days, you know, your body is all about survival. And if it's afraid that it's not going to be able to survive, you go out in the cave and you get chased by a bear or a tiger, and it's not going to be able to, you know, have the appropriate fight or flight response. It's trying to protect you. And the last thing it's going to do is let you get pregnant, because that's just another risk, either to you, it slows you down, or to that baby. So if your body thinks that it's in a state where it's not going to be able to respond to that stressor appropriately, it's never going to let you get pregnant. So we really work towards healing the body from the inside, addressing gut issues, addressing what's stressing it out, balancing those hormones. A lot of mindset, you know, you hear the story all the time where people that are, you know, really struggling and going through infertility and make the decision to move towards adoption, right? And then all of a sudden they find out they're pregnant because they stopped stressing about it, right? So they kind of made a decision, I'm going this way, and they let that go. And now all of a sudden that stress is gone, and, you know, their body's like, oh, we can do this now. So easier said than done, but, you know, you really got to get into that mindset and work on some stress management, breathing, meditation, anything that you could do to tell your body that it's not getting chased by a tiger and everything's going to be okay.
Yes, I love that. And I also love that you were saying just reduce the stress, because people don't realize that stress can be the number one killer. And it's not just the internal stress, but those external stresses that you brought up: environmental factors, job stress, family dynamics, and etc. And then before you know it, like, if you go to a therapist, they're like, are you stressed? And they start asking you all these questions, and you're like, oh, I didn't think of that, because you didn't know that your body was stressed, but your body is trying to protect you from future harm. And then you talk,
adapt.
yeah. And then the gut, oh my gosh, the gut is so important, because I've heard leaky gut, I've heard sluggish gut, and all of those things. Can you hit on that briefly, and from a physician standpoint, but also from like a patient advocate standpoint? Can you talk about the pros and cons of how important gut health is, and what some of the common gut problems are?
Yeah. So I think, you know, this is really the foundation where I start all my patients on is addressing gut health and toxin exposure and going through a detox, because, you know, really your gut, starting from your mouth all the way down, is it's trying to protect you. It's like your skin on the inside. So there are many, many, many layers to the different parts of your gut. We're talking about small intestine, colon, things like that. There's multiple layers there, and they're all designed to, number one, help protect, as well as help you break down your food and digest and absorb and things like that. So those layers all have a purpose. And over the course of time, when we're exposed to really things that you don't think of being poisonous, but they really are. So we're exposed to all these chemicals in our, you know, just breathing the air and drinking water, there's chemicals there. But these foods that we're eating, that, you know, you go back to caveman days, we didn't have all these foods with all this chemicals and processed things. So we started this consumerism in food, right? Let's make food cheaper so we can feed the masses, and then let's put extra stuff in it, you know, more sugar so that it tastes good, and people are literally addicted to it, right? So when our gut boundary, you know, our gut barrier is being attacked, that barrier, it's kind of like taking, you know, I think about my desk at my office as a smooth piece of wood. And I say, you know, if I just sat there every day and rubbed the same area over and over again for 20 years, at some point in time, those layers are going to start getting worn out. And now at some point in time, you have this raw wood underneath that's never been exposed to the air and to water and things like that. And it's going to get inflamed. It's going to react. So understanding what foods, and everybody has a different response to different foods. And so it's not, there is a list of what we call anti-inflammatory foods, or foods that you need to avoid. But I like doing individualized testing to know exactly what food is causing stress to your system. And then we come in on the other side with supplements that are going to help to build those layers back up again and help your body protect. So when you think about leaky gut, what happens in those layers have been destroyed over time. And now you're down to one cell layer, and those cells aren't used to all that exposure. They're used to something coming in and kind of knocking on the door, and it looks and says, oh yeah, I recognize you. You've been through my, all the soldiers that are out, out at the gate, right? And they've let you in, so you must be a safe thing. And when those soldiers aren't there anymore, and everybody's just coming in, and it's kind of overflow, and then inflammation happens, which allows those cells to stretch out or get spaced out, and there's fluid in between. And now there's no knocking on the door, everybody's coming in. And there's no barrier there that's going to say, hey, you're a bad guy, you're a good guy. So now bacteria and toxins and chemicals are coming right into the bloodstream. And now your body is fighting a war. It is reacting to all that stuff that looks foreign, and it creates a huge amount of stress on your system every time you eat. And so that's really where that foundation needs to come from. And you can see it in a multitude of ways. There's definitely GI symptoms people experience. We call it IBS, irritable bowel. Sorry, hold on.
Oh, no worries. The IBS, y'all, is the irritable bowel syndrome.
So irritable bowel syndrome. And most of the time, you can have, when we officially diagnose somebody with that, it's either IBS with diarrhea or IBS with constipation. But I tend to see a mixture all over the place. Some people say, every time I eat, this is patients that come to me, say, how is this affecting your quality of life? And they say, well, I never want to go anywhere. I don't want to go out to eat with friends because I have to excuse myself from the table many times, to the point where sometimes they have to carry an extra set of clothes in their car if they're going somewhere, farther away, because they've had accidents. And it's very frustrating because they don't know what's causing it. So there's no way for them to control it. And there's not really any good medication, because the side effect of a medication to control diarrhea is constipation. And so you end up with this, one day I'm going to the bathroom 5 times a day, and then I don't go for 3 or 4 days. And now I'm uncomfortable, my stomach hurts, I'm bloated. And then you finally go, or you take medication to make you go. And then now you have another day where you're, you can't leave the house basically. So it can become very dysfunctional, not just from the physical symptom perspective, but socially. I don't want to go places where I might be riding in the car with a friend. She wants to go to the mall or go shopping or something. And I'm like, what if I have to stop and, go to a gas station 3 times before we get there? And it's embarrassing for those women, which is mostly what my patient population is. So definitely we see gut symptoms, but that whole leaky gut thing can be portrayed in different ways. So you can have pain. You can just have simply joint pain. Do I have, people want a diagnosis. Do I have rheumatoid arthritis? Do I have fibromyalgia? I don't know, but what's happening is your body is reacting to all those things, and the inflammatory response just, increases all these pain signals, and you just kind of wake up achy every day. And sometimes it's your neck, sometimes it's your knee, it's your hip, it's your foot, it's all over the place. So you can't go to an orthopedic surgeon and say, I hurt everywhere, put injections at every joint. Again, it's coming from the gut, and you have to address that. And then, sorry, two more symptoms I want to talk about is kind of this chronic fatigue, and then what we call the mood, the brain, you're sluggish. I feel like I'm in a fog. I can't focus. I can't think. I'm tired all the time. Those can come from, again, your body just reacting to that stress all the time. It never gets a break. I say that we're running the marathon of life uphill all the time without ever taking a break or having, that slope where it flattens out a little bit. We're just constantly trying to sprint uphill, and your body never rests.
Wow. So the leaky gut, the mood, and then the stress. So all of those components. And then the last question as we wind down, because I want to be respectful of your time, Dr. Duffy.
Sure.
So do you feel like people need to start with examining the gut health as their root cause analysis, and then working from that area to kind of help with everything that's going on within their body?
That is what I do in my practice when we're addressing what I call the pillars of health. So gut health and detox is the first pillar. Then we look at nutrition, or food, what we're eating, hormones, fitness, and then stress management, mindset are all kind of work together. But those are my 5 pillars. But I would say that my best results come from when we start with dealing with the gut. And there's things that you can do on your own before you seek out a doctor like me. Again, I think that having the knowledge is really the best way to do that. So to have a food sensitivity test, there are tons of them out there. So it's a little overwhelming to go, researching what test should I do, but having a test that tells you what's going on and what your body's reacting to makes it much more easy for you to address. But you can start right away. I'll tell you the top 4 foods that I see almost in everybody is gluten. We hear that all the time. Where is that coming from? But gluten is just a serious chemical right now, really. I mean, we used to go to the bakery, right? When we were younger, maybe the bakery is where you would go to get your bread, and they had the fresh bread that morning, and then they had day old bread, right? On the back shelf, it was already 50% off. You would buy it for making croutons or French toast or something like that, but that was not, good enough to just eat as regular bread. Well, now you go to the grocery store and that loaf of bread might have been sitting on the shelf for a week or so, and you take it home and it can sit on your, countertop for 2 weeks, and still you open it up and it's nice and soft and smells just as fresh. It doesn't have any mold on it. What is that? It's all chemicals. So whether we're really allergic to the gluten or we're allergic to the process and the chemicals that are added to that gluten to help it, be lasting longer and taste good, and again, be able to feed the masses because we have to make so much of it. I know I'm going off on a tangent, but gluten's number 1, dairy is number 2. Eggs are very common, nuts, then we get into some other things like nightshades and things like that. But I have had so many patients who just simply by eliminating gluten can really eliminate a lot of those things, because really you're not just getting rid of the gluten, you're getting rid of the chemicals. So my biggest pet peeve is gluten-free everything. So that doesn't mean just because it's gluten-free, you can go eat pasta and pizza and bread, because most of the time they're adding more chemicals to whatever it is they're using instead of gluten to make it taste okay. So really we want to be grain-free if we can, for the most part, except for maybe some quinoa or something like that. But, go back to the basics. What did the cavemen eat? They had vegetables, they had some meat, maybe some berries and some nuts. That's really what our diet needs to be, is as simple as possible. And if we can start there and then find a good quality probiotic, again, that can be overwhelming, but start balancing that gut microflora again, because that microbiome is that first layer of protection for you. So those are 2 things that you could start with right off the bat. Avoid chemicals as much as you can, avoid the foods that we know cause inflammation, and then start healing your gut with some good quality probiotics.
Amazing. And then I'll also chime in by telling you all, make sure you're listening to your body. Your body is so powerful, and your body is always going to speak to you. One thing that helped me early on when I was having some GI, so that's gastrointestinal issues, was keeping a food journal. So it was a way that I kept up with my own body's metrics. Like if I ate something, like how did it make me feel or whatnot. And then also just go back to just analyze, how were your ancestors brought up and what did they eat? And if you go back to that, it will definitely help you where you are now. So Dr. Aimee, I want you to leave the listeners and viewers with your call to action for this segment, and then plug your website and your social media handles.
Awesome. Yeah, I think, my passion is just teaching. The Latin word for doctor is really to be a teacher. And so, being on platforms like this and speaking, and I really just want people to know that there's a different way, because it can be really frustrating in the traditional medical approach to go in with a symptom and be told everything's normal, or, you know, like you said in the beginning, you know, here's your pill for this and here's your pill for that. Now you're turning around, you're on 10 different prescriptions, and then you don't know what's a symptom and what's a side effect. And so we are out there. Integrative functional medicine, you can Google them. I would love for people to come, you know, and let me help you in my practice, but that may not be practical depending on where you are. You know, this is a show that's going to be spread out all over the world, hopefully. So I just want to share that message that we do need to be advocates for our own health, and recognize that, hey, I don't feel good, this isn't normal, and find somebody who can listen to you, take the time to understand your symptoms and do some testing and help guide you, help you understand what's going on. And there are lots of practitioners like myself out there. My website, I have two. I have AimmeeDuffyMD.com. That's spelled AIMEEDuffymD.com. And my practice is called Carolina Integrative Medicine. And that website is carolinaintegrativemedicine.com. You can find both of those on Facebook and Instagram and TikTok and YouTube. So we have channels searching for any of those, and you can go back and forth. So if you go to my website, you'll be able to have a link to go over to my practice website as well. And the call to action, like I said, is just whether you want to reach out to me. We start at my practice with a free discovery call. So you can schedule that right on my website, create a call. It's about 15-20 minutes with my staff. We find out what's going on with you and how we can help you improve your life and feel better. And then we go from there. What's the next step? I also have a book. So Normal Doesn't Have Side Effects is on Amazon, and right now on Kindle, but should be in the next week or two available for print as well. So that's another way to get started and describes a lot of what we've just talked about today.
And there you have it, listeners and viewers of Jem's podcast. Once again, I am the founder and host, Miss Genesis Amaris Kemp. All of Dr. Duffy's contact information will be in the show notes, so you could definitely scroll down and connect with her. For those of you listening, make sure you subscribe and share this segment. Don't forget to leave us a review wherever you're listening. And lastly, but not least, we are ranked in the top 3% globally out of 2.8 million podcasts per www.listennotes.com. So you could come on over and support the podcast by being a brand ambassador or a brand sponsor. And then you could also find all of our video content at YouTube, which is at Gems with Genesis Amaris Kemp. Make sure you listen to your body, pay attention, and don't dismiss those subtle clues, because they can very much save your life. So be proactive versus reactive. And until we chat next time, peace, love, and lots of blessings. Have yourself an amazing day.